Hello everyone. In this particular session of the pharmacology, I will be discussing about the antiplatelet drugs. So first of all, let me just give you the classification of the drugs which are acting or which are having the antiplatelet effect, right? First and foremost, a very important drug, that is a COX inhibitor. And this particular COX inhibitor, it is aspirin. Usually the COX inhibitors, they act as the NSAIDs, non-steroidal anti-inflammatory activity will be there. But one particular COX inhibitor which is having the antiplatelet action is the aspirin. And the next important group of drug which is having the antiplatelet effect is phosphodiesterase inhibitors, right? PDE inhibitors. Right? Phosphodiesterase enzyme inhibitors. So these PDE inhibitors, the example is dipyridamole. Right, this particular example is the dipyridamole, that is your phosphodiesterase inhibitors. And the next important group of drugs like what we have is P2Y12 antagonist, that is ADP antagonists. Right, that is adenosine diphosphate antagonists. Right, P2Y12 inhibitors. So what are the examples of this P2Y12 inhibitors or the ADP antagonist? We have reversible and as well as the irreversible. Okay, so we have the reversible ADP antagonist and as well as the irreversible ADP antagonist. So what are the examples of reversible? Reversible ADP antagonists are cangrelor and as well as ticagrelor. Right, reversible are cangrelor and as well as ticagrelor. So these are the reversible ADP antagonists. Whereas if you take this irreversible ADP antagonist, that is your P2Y12 inhibitors, it includes number one, ticlopidine, then we have clopidogrel, then we have prasugrel. Right, so these are the irreversible ADP antagonists which are your P2Y12 inhibitors. Then followed by that we have glycoprotein 2B3A antagonist. So what are the examples of glycoprotein 2B3A antagonists? So the examples of the glycoprotein 2B3A antagonist that includes number one, 𝐒𝐲𝐫𝐞, right, it includes number one, 𝐒𝐲𝐫𝐞, then followed by that we have tirofiban and as well as eptifibatide, right, tirofiban and then we have eptifibatide. So this is your glycoprotein 2B3A inhibitors. Then followed by that we have PAR antagonists, right? And what are the examples of this PAR antagonists? So the examples include number one, voroperox, and then we have atoperox. So these are the PAR antagonists. So under the group of drugs that is antiplatelet drugs, we have COX inhibitors, that is aspirin, phosphodiesterase enzyme inhibitors, that is dipyridamole, ADP antagonists, that is reversible are your cangrelor and ticagrelor, and irreversible are ticlopidine, clopidogrel and prasugrel. Then we have glycoprotein 2b3A inhibitors or antagonists, that is abciximab, tirofiban and as well as eptifibatide. Then we have PAR antagonists, that includes voroperox and as well as the atoroperox. Okay. Now, after having discussed about the classification of these drugs, let me discuss the individual group of drugs and let me discuss the mechanism of action of these drugs. So, after having discussed about the classification of these antiplatelet drugs, let me just discuss about what are the constituents of the arterial thrombi and in what way the antiplatelet drugs will inhibit the formation of the thrombi. So, if you take this arterial thrombi, right, or the venous thrombi, this particular arterial thrombi, the main constituents is the platelets, right. So, within the thrombi, you have the presence of the platelets, and along with the platelets, you have the presence of the fibrin threads, right. Along with the platelets, you have the presence of the fibrin threads. So, these are the constituents of the arterial thrombi. Now, this is the blood vessel and you have the endothelial cells, right. You have these endothelial cells, that is your vascular endothelium. Now, once these endothelial cells are damaged, right, once these endothelial cells they are damaged, there will be exposure of subendothelial collagen, right, there will be exposure of the subendothelial collagen. So, this endothelial cell, once it is damaged, there will be exposure of this particular collagen, and on this particular collagen the platelets they stick, right, on this particular collagen the platelets stick. So, platelets first stick to the damaged blood vessel wall and aggregation occurs, right. So, they stick to the damaged blood vessel wall and further there will be aggregation, right, further there will be aggregation. So, aggregation occurs. Now, once this aggregation occurs, right, once this aggregation occurs, this lead to the release of ADP, right, this leads to release of the adenosine diphosphate, right. This aggregated platelets, they will cause the release of ADP, they will cause the release of the thromboxane A2, they will cause the release of serotonin, right, they will cause the release of serotonin and other substances. So, these substances, that is ADP, thromboxane A2 and as well as serotonin, these substances they promote further aggregation. So, these substances, that is ADP, thromboxane A2 and as well as serotonin, they further cause the aggregation. Right, they further cause the aggregation by activation of, right, by activation of glycoprotein 2b3A receptors on platelet surface. Alright, so these substances they will further stimulate the aggregation by activating the receptors, that is glycoprotein 2b3A receptors on the platelet surface. Okay, so this is how the aggregation of the platelets will occur, and to this aggregated platelets, if there is addition of the fibrin threads by your coagulation pathway, that will result in the clot formation, right, that will result in the clot formation. But we also have a natural antiplatelet substance. There are or there is a substance which is synthesized in the vascular endothelium which is a potent inhibitor of the aggregation of the platelets. And what is that particular substance? That is PGI2, right? So from this vascular endothelium there is release of the PGI2. Now this PGI2, right, which is a prostacyclin, right, PGI2 which is a prostacyclin, it is synthesized in the vascular endothelium and it is a potent inhibitor of the aggregation of platelets. Right, it is a potent inhibitor of it is a potent inhibitor of the aggregation of the platelets. Okay. Now there is a natural antiplatelet substance. Right. Now many of the drugs, like whatever I have discussed in the classification, what will be their mechanism of action? The main drugs, they act as antiplatelet agents by thromboxane A2 inhibitor, right? And what is that particular drug? That is aspirin. Aspirin, right, it is a thromboxane A2 inhibitor. Then we have ADP antagonists. What are the examples of your ADP antagonists? That is your Clopidogrel and as well as ticlopidine. We have glycoprotein 2B3A inhibitors, that is your apixaban, tirofiban and as well as the eptifibatide. So this is how the antiplatelet drugs they work. So first of all you need to understand how the aggregation of the platelet occurs. Once the vessel is injured, there will be aggregation of the platelets, right? And these aggregated platelets, they will cause the release of ADP, thromboxane A2 and serotonin, and these substances, they will further stimulate the aggregation of the platelets and that will result in the clot formation. So these aggregated platelets or these particular substances, they are being stimulated or they stimulate the glycoprotein 2B3A receptors on the platelet surface, and that will cause the aggregation of the platelets, to which if the fibrin threads are added, there will be clot formation. Now let me discuss in detail about the individual drug. What is the mechanism of action of their antiplatelet effect? How do they work? What is their adverse effects? And in which are clinical scenarios we use this antiplatelet drugs? So after having discussed about the classification of the antiplatelet drugs like COX inhibitors, phosphodiesterase inhibitors, the ADP antagonist, then we have glycoprotein 2B3A inhibitors and then PAR antagonists. So these are the various groups of drugs in the antiplatelet drugs. Now let me take up the discussion of the very important group of drug, that is COX inhibitor, which is having the antiplatelet action. So if you take this COX inhibitor which is having the antiplatelet action, it is your aspirin. Okay. So aspirin, it is an NSAID, it is a non-steroidal anti-inflammatory drug, but this aspirin, whenever it is given in low dose, it has antiplatelet activity. Right, whenever it is given in low dose, it has the antiplatelet activity. Now again remember, the aspirin, it is not just having only the antiplatelet activity, but when this aspirin, it is given in high dose, this aspirin when given in high dose, it is having the anti-inflammatory activity. Now this particular property of the anti-inflammatory activity, it is used in the treatment of the rheumatic fever. Right, it is used in the treatment of the rheumatic fever. So please remember, in case of rheumatic fever, the most common symptom or the most common feature will be polyarthralgia and polyarthritis. So for the treatment of polyarthralgia and polyarthritis, we give high dose salicylates, right? That is your aspirin. Whereas low dose aspirin, it has the antiplatelet activity, whereas high dose aspirin, it has anti-inflammatory activity, which is used in the treatment of the rheumatic fever. Now let me discuss about the antiplatelet activity and what is its mechanism of action. Now aspirin, it is a COX inhibitor. Now let me tell you, in which particular pathway your COX enzyme is required. So we have a substance called as the arachidonic acid. Right, we have a substance called as the arachidonic acid. Now this arachidonic acid, in the presence of enzyme, right, in the presence of enzyme COX-1 and as well as COX-2, right. So COX stands for cyclooxygenase 1, COX-2 stands for cyclooxygenase 2. So in the presence of the enzyme COX-1 from the arachidonic acid, there is synthesis of the prostaglandin I2, right, there is synthesis of the prostaglandin I2, and there is also synthesis of the thromboxane A2, right, there is also synthesis of the thromboxane A2. Now if you see this thromboxane A2, it has the platelet function. Right, what it will cause? It will cause the platelet aggregation. Right, it causes the platelet aggregation. Which one? The thromboxane A2. Leave about COX-2, right, it is mainly required for the anti-inflammatory activity. Now, what is your aspirin doing? Your aspirin, it is inhibiting this COX-1. So, once your COX-1 enzyme, that is cyclooxygenase enzyme, if it is inhibited, then there is no synthesis of the thromboxane A2, right, there is no synthesis of thromboxane A2, and thereby the platelet aggregation does not occur, right, thereby the platelet aggregation does not occur. So in that way your aspirin is having the antiplatelet activity, and please remember this aspirin inhibits the cyclooxygenase enzyme irreversibly, right. So it inhibits the cyclooxygenase enzyme right, it inhibits the cyclooxygenase enzyme irreversibly and thus results in decreased synthesis of thromboxane A2 and as well as decreased synthesis of the PGI2. Now this thromboxane A2, where is it produced by? This thromboxane A2, let me tell you, it is produced by the platelets, right, it is produced by the platelets, and you need to know that platelets do not contain the nuclei. So thromboxane A2 is not synthesized till there is production of the fresh platelets. Only when there is synthesis of the fresh platelets, during that particular time there is synthesis of the thromboxane A2. Until there is no synthesis of the fresh platelets, there is no synthesis of thromboxane A2 as well. Whereas if you take the vessel wall, right, that is the endothelium of the vessel, it contains nucleus, right, the vessel wall contains the nucleus, and thus it can resume the synthesis of enzymes which are required for the formation of the prostacyclins. But thromboxane A2 synthesis will occur only when there is synthesis of the new platelets. So what is the net effect now? So vessel wall, it contains the nucleus, so it can resume the synthesis of the prostacyclins, right, it can resume the synthesis of the prostacyclins. So what is the net effect now? The net effect is the inhibition of thromboxane A2 synthesis by the aspirin, leading to anti-aggregatory effect, right. So your thromboxane A2 synthesis does not occur. Once this thromboxane A2 synthesis does not occur, there is no platelet aggregation. That will be the net effect of the aspirin. Now you need to remember that aspirin inhibits the thromboxane synthesis, but it does not inhibit the enzyme thromboxane synthetase. Please remember this very important point. You can get confused in the multiple choice question. So this aspirin, it inhibits thromboxane, right, it inhibits the thromboxane synthesis. It does not inhibit right, does not inhibit, right, does not inhibit the thromboxane synthetase. Now, what is the substance or what is the drug which will inhibit this thromboxane synthetase? That is 𝐷𝑒𝑧𝐻𝑒𝐵𝑒N. 𝐷𝑒𝑧𝐻𝑒𝐵𝑒N, right? 𝐷𝑒𝑧𝐻𝑒𝐵EN is the drug which will inhibit this thromboxane synthetase. And as already I have said you, for the antiplatelet activity of aspirin, low doses of aspirin are required, right? And what is that low dose of aspirin? That is in the dosage of 40 to 325 milligrams, right? That is at the dosage of 40 to 325 milligrams per day. And another important point related to your aspirin and platelets is that aspirin has no effect on the platelet survival time and their adhesion to the vessel wall. So this is another important point. This aspirin, it has no effect on, right, it has no effect on, right, it has no effect on the platelet survival time and their adhesion to the vessel wall. So these are some of the very important points related to your aspirin. So aspirin, it is a COX inhibitor and it will inhibit the synthesis of the thromboxane A2, and not only that, it will also inhibit the synthesis of the PGI2. And this thromboxane A2 is produced by platelets, and as platelets do not contain nuclei, thromboxane A2 is not synthesized till there is production of the fresh platelets. And this aspirin, it inhibits only thromboxane synthesis. It does not inhibit the thromboxane synthetase. And what is the substance which will inhibit the thromboxane synthetase? That is 𝐷𝑒𝑧𝐻𝑒𝐵𝑒N is the substance which will inhibit the thromboxane synthetase. And for antiplatelet action of the aspirin, you need to give low doses of aspirin, that is 40 to 325 milligrams. And high dose of aspirin, it is having the anti-inflammatory activity which is used in the treatment of polyarthritis in rheumatic fever. Now, this antiplatelet activity, where is it used? It is used in the treatment of the coronary artery disease. So, in coronary artery disease, there is formation of the clot. And what does the clot contain? The platelets and as well as the fibrin threads. So, this aggregation of the platelets is one of the factors responsible for the formation of the clot. Now, whenever you give aspirin, it has antiplatelet action and that will prevent the clot formation. So, one point where it is being used is used in the treatment of the coronary artery disease. Next, the other scenarios where we use this aspirin is, it is also used in the treatment of the atrial fibrillation. In atrial fibrillation, right, in atrial fibrillation, there is chance of the thrombus formation within the left atria. And this thrombus, whichever is formed in the left atria, can undergo embolization where the individual can develop the cerebrovascular accidents. So, in order to prevent the thrombus or the clot formation within the left atrium, we give this aspirin. And in atrial fibrillation, we have a scoring system called as CHA2DS2 VAS scoring system, right? The scoring system is CHA2DS2 VAS scoring system. Now, when the score is 1, that is the point when you need to give aspirin. But when the score is 0, we don't give this antiplatelets. And when score is around 2, right? When CHA2DS2 VAS scoring system, if the score is 2, then we give anticoagulant, right? We give warfarin. So, in the topic of anticoagulants, I have discussed that warfarin is used in the treatment of the atrial fibrillation. And remember, when will you give warfarin in atrial fibrillation? You will give warfarin in atrial fibrillation when CHA2DS2 VAS scoring system is 2, we give anticoagulant. When CHA2DS2 scoring system is 1, then we give the antiplatelet, that is aspirin. And please remember, aspirin has no effect on platelet survival time and their adhesion to the vessel wall. And another scenario where we give this aspirin is, we also give in the treatment of the pulmonary embolism and as well as the deep vein thrombosis. So, these are all the conditions. any hypercoagulable state or any clinical scenario where there is aggregation of the platelets, we give this particular aspirin. So in the recent times, this aspirin is also being used in the COVID-19 infection. Right, in the recent times, it is also used in the treatment of the COVID-19 infection. Why? Because COVID-19, it is a hypercoagulable state. So in order to treat that hypercoagulability secondary to your COVID-19, we give this aspirin. So this is about the aspirin having the antiplatelet action. Now followed by that, let me discuss another important antiplatelet drug, that is dipyridamole. Right. So if you see the next antiplatelet drug, that is dipyridamole. So if you take this dipyridamole, it is another drug that acts by inhibiting the enzyme phosphodiesterase. Right? This dipyridamole is a drug which will inhibit the enzyme it inhibits the enzyme, the phosphodiesterase. Now, what is this particular phosphodiesterase? Phosphodiesterase is the enzyme which will cause the breakdown of the cyclic AMP. Now, what is your dipyridamole doing? It is inhibiting the phosphodiesterase enzyme. So once this phosphodiesterase enzyme is inhibited, then the breakdown of the cyclic AMP does not occur. Right? The breakdown of the cyclic AMP does not occur. So whenever you are giving dipyridamole, what will happen to your cyclic AMP levels? There will be increase in the cyclic AMP levels. Now this increased cyclic AMP, what it will do? It will potentiate the prostacyclin. Right? This will potentiate the prostacyclins. And these prostacyclins, they have the anti-aggregatory effect. Now let me tell you few points related to your prostacyclin. Prostacyclin, it is also called prostaglandin I2 or the PGI2. Right? Prostacyclins, it is also called prostaglandin I2 or it is also called as the PGI2. Now this prostacyclin, it is a prostaglandin member of the 𝐒𝐼𝐶 family. So your prostacyclin, it is a prostaglandin member of the 𝐒𝐼𝐶 family of the lipid molecules. Right? And this prostacyclin, which is also called PGI2. Now what is the action of this prostacyclin? It inhibits the platelet activation. Right? It inhibits the platelet activation. And not only it inhibits the platelet activation, this prostaglandin I2, it also has the effective vasodilatory activity. Right? It also has the effective vasodilatory activity. Now, this prostacyclin, which is your PGI2, when used as a drug, it is also known as epoprostenol. Right? When used as a drug, it is also known as the epoprostenol. So that is about your dipyridamole. So dipyridamole, it is a phosphodiesterase enzyme inhibitor which also has the antiplatelet activity. So phosphodiesterase is the enzyme which will cause the breakdown of the cyclic AMP. Now what this dipyridamole will do? Dipyridamole will inhibit the phosphodiesterase enzyme and thereby cyclic AMP breakdown does not occur. So what will happen to your cyclic AMP levels? There will be increase in the cyclic AMP levels. and this increased cyclic AMP will potentiate the action of the prostacyclins, and these prostacyclins are nothing but the prostaglandin I2 or your PGI2, right. This prostaglandin or prostacyclin, it is a prostaglandin member of the icosanoid family, and when used as a drug, it is also known as the epoprostenol, and this prostaglandin I2, it inhibits the platelet activation, and it also has the vasodilatory activity. Now, after having discussed about the COX inhibitor and as well as the phosphodiesterase inhibitor, let me discuss P2Y12 receptor antagonists, which are having the antiplatelet activity.